Looking around these passengers, they appear like any other group of Australians, flying off to Asia and the Philippines, intent on holidays, business and fun.
We're flying from Manila to Cebu, where there's some really pretty islands. We saw a volcano.
But this group is different. All volunteers from the Rotary Club of Canterbury in Melbourne and orthoptic internship students from La Trobe University. Their annual trip will dramatically change the lives of many of the poor people they meet forever. They will also forge relationships between strangers and cultures that will last a lifetime.
We're from Rotary Club of Canterbury, and we're glad that Australians are here to do the eye screening and as well as the ear screening.
Over the next weeks, these medically untrained volunteers from Melbourne, using Australian-designed techniques and simple aids and working with specialist doctors and local Rotary volunteers from the Philippines, will screen thousands of the poorest of the poor for cataracts and preventable blindness, and thousands of young primary school children for hearing disorders. Ultimately enabling the restoration of sight to hundreds and enhancing future education and employment opportunities for children held back by the invisible disability of a serious hearing disorder. Disability is a major blockage to personal progress in any society. But here, where formal social security is negligible and basic eye care services and hearing services are extremely limited, not being able to see or hear properly to contribute to the extended family's daily struggle for survival has profound impacts on the life opportunities of these family-based and often extremely poor communities. It also makes life extremely dangerous, especially for children and the aged, when negotiating traffic and other public spaces where good hearing and sight are essential. On this trip, local authorities have selected the island of Bohol.
The two previous national surveys on blindness showed the highest incidence of blindness was from Bohol, and incidence of deafness as well is very high in just this one island. They have also stopped in Manila, and we have done screening in the shanties and in the slum areas, which is quite admirable.
Using local facilities such as basketball stadiums and schools as screening centres, and an advertising word-of-mouth campaign managed by the Philippines Rotary clubs of the area, large groups of patients are tested and assessed by Australian and local Rotary volunteers in a kind of triage system, with assistance provided to each patient in accordance with the needs of their individual person.
We covered 8 towns and a total of 1,530 people were screened for eyes.
Some may just need prescription glasses, and these are provided at a nominal cost of $1. Others may have more advanced eye health problems, ranging from severe disease linked to poverty and nutrition.
Goiter, bulging eyes, and then the right eye is outward.
While others will have cataracts, a veil of opaque growth which spreads across the eye's lens, ultimately causing blindness. This is often caused by advancing age or exposure to high levels of ultraviolet light, the result of a lifetime of working in strong sunlight and agriculture.
We picked up about 235 to 38 cataract surgeries, more than half of which was quite amazing, had bilateral cataracts, which means cataracts in both eyes. So they were blind from cataract.
The local medical specialists, who are also in attendance, such as Dr. Oliver Yu, will arrange surgery and hospital care for those who require it, and then treat these more serious medical cases.
This is our patient. We found her when we did the
screening last Monday in Luon. She's 72 years old. 73 years old. She's correcting me now. We diagnosed her to have cataracts on both eyes, much more dense on the left eye.
The Ramira Community Hospital, run by founders Dr. Luther Ramira and Mrs. Dinah Ramira, allow their hospital and equipment to be used for the treatment of severe eye conditions and cataract surgery.
We started this in 1975, this small 10-bed hospital under Medicare, and after 2 years, again, God's plan, we have to follow His plan for us. We were given an opportunity to expand to 25 beds, on to 50, 75, now it's 120 beds. And with all our doctors holding clinics here, with all their specialization. So we granted them the space for their use.
She can barely see the big letter F, which is 2400 on the right eye. Now we will get an A-scan biometric reading for her left eye so that we can do the surgery. We did a phacoemulsification and we placed a rigid 5mm intraocular lens whereby we extended our corneal incision from 3.1 to 5.5 millimeters. We did the procedure in about 15 minutes, so we did it under topical anesthesia. We are just placing a patch over their left eye because she's going home to the islands. She can remove the patch actually after when she arrived. So tomorrow we're going to see her again, take a look at the operated eye.
Yes, I'm very, very happy, and I'm very thankful to our foreigners doctor and doctora during the examination.
She can see much better now when he covered his one eye with his hand. He cannot see anything except like a cloudy thing that she sees. But now she can see very clearly. After 3 months from the operation, she can go to the farm. She can go to the farm
Plant corn,
and plant corn.
and kamuti.
She is thankful to the mission. Could be the Rotary Club of Canterbury and also the Cataract Foundation and the Rotary Club of Bacolod North and Rotary Club of Tagbilaran that it is her dream come true.
Moving from small town to schools across the island, this volunteer group also helps provide basic health testing services. These are services which we take for granted in the Australian primary school system, but are simply not available to children in the school system of the Philippines. Visiting numerous primary schools, thousands of young children are screened for both hearing and sight problems, and the more serious cases referred for specialist treatment, thereby allowing children to maximise their learning opportunities in the classroom. Rotary volunteers in the Philippines and from Australia make a profound difference to the quality of life and future opportunities of these people. You can help by providing funds to extend these screening processes across large groups of disadvantaged. But more importantly, you can help people who suffer from easily treatable preventable blindness and volunteer to be part of this annual project and spend some of your time helping people less fortunate than yourself. More importantly, your time as a volunteer, even if you have no medical training, will provide you with the opportunity to not only change people's lives, but to meet them as fellow human beings and feel their kindness and generosity of spirit. You will also witness firsthand their overwhelming patience and genuine appreciation when you contribute to the restoration of sight and their return to independence and autonomy, their return to their capacity to contribute to their family rather than being a burden on it. All previous volunteers regard this project as exceeding all their expectations and providing a genuine experience of personal growth. They also enjoyed the trip and meeting the real people of other countries in their own exotic locations, and not just being a tourist. They believe they returned to Australia with a life-changing, deeply felt insight into the genuine needs of others and a profound respect and compassion for the way others less fortunate than ourselves face life's challenges with quiet dignity.